After 60, your health isn't just important, it's everything. Every decision you make, whether it's the food you eat, the walks you take, or the doctor you choose to trust, can ripple through the rest of your life. That's a sobering thought, isn't it? Because while many doctors are caring and dedicated, the hard truth is not all are. Some will smile warmly, scribble a prescription, and send you on your way, but miss the bigger picture entirely. And sometimes, their words reveal more than their actions. That's why in today's video, we're digging into something most people overlook. The phrases doctors use that should instantly raise red flags. Because believe it or not, the way your doctor talks to you can quietly reveal whether they see you as a valued patient or just another appointment on their calendar. Stay with me, because what you hear today might just save you from years of frustration or even from harm. And before we dive deeper, don't forget to subscribe and hit the bell. You don't want to miss these kinds of life-protecting insights. Now here's the thing. Once you're over 60, the stakes are higher than ever. Your body is more sensitive to mistakes, medications, and misdiagnosis. You can't afford a doctor who cuts corners or brushes off your concerns. You need someone who respects your age, listens with care, and tells you the truth, even when it's not what you want to hear. Unfortunately, not every physician meets that standard. And often, the warning signs aren't in what they do. They're in what they say. Think about it. Maybe you've had a doctor dismiss your symptoms with a quick, "That's normal for your age." Or perhaps they rushed through your questions as if your time didn't matter. If that's ever happened to you, you know how unsettling it feels. And if you haven't experienced it yet, I want you to be prepared. Because these subtle signals can make the difference between good care and dangerous neglect. If this resonates so far, go ahead and subscribe right now. Because we're building a community here where seniors look out for each other. The truth is, many of us grew up trusting doctors without question. Back then, a white coat meant authority, honesty, and safety. But the healthcare world has changed. Insurance pressures, overbooked schedules, and corporate medicine have made it harder for even well-meaning doctors to give patients the time and attention they deserve. That's why you can't rely on the system to protect you. You have to protect yourself. And it starts with knowing which words should never pass your doctor's lips. In a moment, I'm going to share 7 specific phrases that should set off alarm bells the second you hear them. These aren't just careless words. They're signs that the doctor may not be giving you the careful, thorough care your life depends on. And if you've ever wondered, how do I really know if my doctor has my best interest at heart? This video is your answer. So stick with me, because by the end, you'll have a clear sense of what to watch out for, how to respond, and when it's time to walk away. And while you're here, don't just watch, subscribe. Because every week, we're uncovering powerful truths about senior health that most people don't talk about. But you deserve to know. If it's not bothering you that much, let's not worry about it right now. Have you ever had a doctor say that after you've explained something that is bothering you? If you're over 60, I want you to pay very close attention, because this one seemingly harmless phrase is a huge red flag. On the surface, it sounds reassuring, like they're trying to calm you down. But underneath, it reveals a dismissive attitude, the kind that brushes off early warning signs that could become serious health problems later on. And here's the truth. After 60, your body can change quickly. Something that seems small today could turn into something major within weeks. Any doctor who waves off your concerns instead of checking them out is not protecting you. They're putting you at risk. Now let me pause here. If you find this kind of information helpful, make sure you subscribe and tap the bell icon. That way, you'll never miss these life-saving insights that every senior deserves to know. Here's what makes this phrase even more dangerous. It feeds into a habit so many of us were raised with, the tendency to downplay our own pain. Maybe you grew up being told not to complain, not to make a fuss, not to be a burden. Sound familiar? So when a doctor tells you, let's not worry about it, it almost feels like permission to stay silent about something that might actually be serious. And silence at this stage of life can be deadly. Now, of course, not every little issue is urgent. We know that. But it is not a doctor's job to make assumptions without proper checks. A good doctor will listen carefully, ask follow-up questions, maybe run a test or two, not just for answers, but for your peace of mind. A bad doctor? They'll brush it off, rush through the appointment, or worse, spend more time staring at their computer screen than listening to you. Remember this. Trust isn't built through empty reassurance. It's built through action. If your doctor truly respects you, they'll never dismiss what you say as not a big deal. Because one wrong call at this age could mean catching something too late. So the next time you hear that phrase, let's not worry about it. I want you to stop and ask, why not? If it's worrying you, then it deserves attention. And if your doctor doesn't see that, then maybe they're not the right partner for your health journey. And hey, before we go to the next red flag phrase, make sure you're subscribed. Because the next one might shock you even more. It's something many seniors hear all the time without realizing the danger hidden in those words. The second red flag you should never ignore is when a doctor says, that's just part of getting older. Now, at first, that might sound reasonable, right? Aging does bring changes. We all expect a few more aches, maybe a little fatigue, or the occasional memory slip. But here's the danger. When a doctor uses this phrase too quickly, too often, or without doing any real tests, it's not just lazy, it's neglect. And neglect, after 60, can be deadly. Think about it. You go in with joint pain, fatigue, or maybe even a sudden change in memory. And instead of investigating, they shrug and say, well, that's just aging. What they're really saying is, I don't want to dig deeper. That's not reassurance. That's dismissal. And listen, I need to pause here. If this resonates with you, make sure to hit that subscribe button and turn on the bell. Because these red flags aren't just stories. They're warnings that could save your life or someone you love. Here's why this phrase is so dangerous. Let's say you actually have a thyroid imbalance or a vitamin deficiency, or maybe early signs of something more serious like dementia or even cancer. All of those can look like normal aging, but they're not. They're treatable, manageable, sometimes even reversible if they're caught in time. But if your doctor shrugs it off as just part of getting older, you could lose months, even years, before anyone takes a closer look. And by then, what was once manageable may now be much harder to treat. And here's the tricky part. It doesn't always come across as rude. Sometimes it's subtle. Maybe they say it with a smile or in a kind tone, but underneath, the message is still the same. You don't matter enough for me to dig deeper. That's heartbreaking, especially when you've spent decades working, caring for family, and contributing to the world. You deserve to be seen, not brushed aside. A great doctor never hides behind age. They know every senior is unique. They'll ask questions, they'll run tests, they'll look for answers, because they know that sometimes what looks small is actually the first clue to something much bigger. And catching it early could change your whole future. So if you ever hear a doctor casually dismiss your concerns with that's just part of aging, I want you to stop and think hard. Is this the person you trust with your health? Because aging is natural. But suffering? That's not. And how you're treated as you age is not just fate, it's a choice. Make sure your doctor is someone who chooses you. And don't go anywhere, because the next red flag is one many seniors hear all the time, and it might be the most dangerous phrase yet. So stick with me, and if you haven't already, hit that subscribe button now. The third red flag to watch out for is when a doctor says, let's wait and see. Now, at first, that might sound cautious, even wise. But here's the truth. When you're over 60 and dealing with new or unexplained symptoms, let's wait and see can be a dangerous shortcut. What it often really means is, I don't want to dig deeper right now. And that kind of delay, it can cost you. Because at this stage of life, things change faster. A small issue can snowball into something serious before you know it. Whether it's your heart, your memory, your joints, or even a hidden infection. That's why early detection is everything. So when a doctor says, let's wait and see, I want you to pause and ask yourself, what exactly are we waiting for? Are they monitoring something specific? Is there a follow-up plan? Are tests being scheduled? Or are you just being brushed off? Because if the answer is vague, that's your cue to speak up. And hey, before I go further, if you find this kind of information eye-opening, make sure to hit that subscribe button and ring the bell. These aren't just stories. They're warnings that could literally save your life. Here's where this phrase becomes especially dangerous. Imagine waiting weeks to get an appointment, finally sitting down with your doctor, sharing your concerns in detail, and all you get in return is a casual wait and see. No answers, no action, no clear direction. That leaves you walking out of the office just as confused as when you walked in. And that's not care. That's dismissal. A great doctor doesn't hide behind waiting. Even if it doesn't look urgent, they'll at least investigate, run tests, or set up a clear monitoring plan with checkpoints. They'll explain what they're watching for and what would signal it's time to act. That's proactive care. But a bad doctor? They use wait and see as a way to move you along so they can get to the next patient faster. So if you hear let's wait and see with no explanation, no urgency, and no clear next steps, don't ignore it. Treat it as a red flag, because after 60, time is too precious to waste. You need a doctor who acts, not one who delays. And stay with me, because the next red flag is one that too many people brush off until it's too late. Trust me, you want to hear this one. And if you haven't already, go ahead and subscribe now, because these are truths every senior deserves to know. The fourth red flag is when a doctor says, it's probably nothing. Now, on the surface, that might sound comforting. You want to believe it's nothing, right? But here's the danger, especially after 60. So many serious health problems begin with tiny symptoms that are easy to brush off. Fatigue, numbness, shortness of breath. On their own, they might not seem like much, but they can be early warning signs of heart disease, infections, or even more serious conditions. So when a doctor dismisses you with it's probably nothing without asking detailed questions or running tests, that's not reassurance. That's neglect. And pause with me here. If this is opening your eyes, make sure to hit that subscribe button and turn on the bell, because the phrases we're covering could make the difference between catching a problem early or too late. Here's the real danger of that phrase. When a doctor says, it's probably nothing, it plants doubt in you. You start wondering if maybe you're overreacting, if maybe your symptoms aren't important. And the next time something feels off, you might stay quiet. That silence can cost you. A good doctor doesn't guess. They don't hand you empty reassurances. They listen carefully, they take you seriously, and they back their words with evidence, whether it's a test, an exam, or a clear explanation. That's what respect looks like in healthcare. But a bad doctor? They assume. They take shortcuts. They move you along with phrases like probably nothing, just to get to the next patient. And that's when dangerous conditions get missed. So here's what I want you to remember. Trust your instincts. If something feels wrong in your body, it matters. And if your doctor tells you it's probably nothing, without checking, question it. Push for answers. Because your health is too important to leave to guesswork. And don't go anywhere. The next red flag is one that catches so many seniors off guard. In fact, it might be one of the most subtle but damaging phrases a doctor can use. You need to hear this. And if you haven't already, subscribe now so you don't miss it. The fifth red flag is when a doctor says, there's nothing more we can do. Now, let's be honest. Hearing those words can feel like a dead end, like a door slamming shut when all you wanted was hope, answers, or at least some effort. But here's the truth. Far too often, this phrase is used prematurely. Instead of digging deeper, instead of exploring options, some doctors use it as a way to stop the conversation. And that is not okay, especially after 60, when your health deserves more attention than ever. Because here's the reality. Medicine is always evolving. New treatments, new therapies, new approaches are emerging all the time. A good doctor knows this. They'll explore every possible path, whether it's medication, physical therapy, lifestyle adjustments, or referring you to a specialist. They won't give up just because the first option didn't work. But a bad doctor? They'll shut it down with a phrase like, there's nothing more we can do, leaving you feeling powerless and abandoned. And you deserve so much better. And let me pause here. If this resonates with you, make sure to subscribe and tap the bell icon, because the rest of this list is just as important. And I don't want you missing the signs that could change everything about the care you receive. Here's the thing. You should never accept that kind of dismissal without questioning it. Nothing more we can do often just means nothing more that doctor's willing to do. And that's when it's time for you to advocate for yourself. Get a second opinion. Look for a healthcare provider who still has curiosity, who still sees possibility, who treats you as a person, not as a problem that can't be solved. Your health deserves effort. It deserves hope. It deserves ongoing attention, no matter your age. So if a doctor closes the door too soon, don't let their words be the final say. Walk out of that office knowing this. There's always more that can be done, even if it means finding the right person to do it with you. And don't go anywhere, because the next red flag might be the one you've heard the most, and it's also the one most people overlook. If you haven't subscribed yet, now's the time, because you need to hear this. The sixth red flag is when a doctor says, "You don't need to worry about that." Now, at first, that phrase might sound comforting, almost like they're trying to protect you from unnecessary stress. But here's the danger. Sometimes it's just a way for a doctor to avoid addressing your concern seriously. And after 60, that can be risky, because what looks minor today could very well be the early sign of something bigger. Think about it. Fatigue, a small lump, a little shortness of breath. Dismissing these things with "don't worry" doesn't make them disappear. In fact, it often means missing the chance to catch a problem early. And you deserve more than vague reassurance. A good doctor doesn't just brush you off. They explain. They tell you why something isn't dangerous right now, what signs to watch for, and when to follow up. That's respect. That's transparency. But if all you get is "don't worry about that," without any clear guidance, that's a red flag. Your health isn't something to minimize. It's something to take seriously. And if you've ever been brushed off like this, let me just say, you're not alone. And that's why I share content like this. So if you haven't already, make sure you subscribe and tap that bell icon, because this kind of knowledge could protect you or someone you love. Now, the seventh red flag is when a doctor says, "There's no need for tests right now." This one really gets me, because tests save lives, especially after 60, when so many serious conditions can stay hidden until it's too late. Tests are often the only way to catch problems early, when they're still treatable. So if your doctor refuses to order tests without giving you a clear explanation, what they're really saying is, "I don't think it's worth my time or effort." And that's dangerous. Waiting too long for a diagnosis can turn something small into something life-threatening. Now, a responsible doctor will talk it through with you. They'll explain which tests are necessary, which ones aren't, and why. They'll involve you in the decision, instead of shutting you out. That's how it should be. But if you hear "no need for tests right now" with no reasoning, no alternatives, no follow-up, that's a warning sign. Don't ignore it. And listen, if these red flags have been eye-opening for you, I encourage you to subscribe. We share honest, practical advice that helps you protect your health, especially after 60, because your well-being matters, and you deserve care that respects and empowers you.